we're glad to see the overdose numbers dropping in St. Louis County. We believe our efforts are starting to have an impact. We have great relationships in the community, community groups that are helping us engage the broad demographic that is affected by the opioid epidemic. But we still have too many people dying from drug overdoses, and we need to redouble our efforts, and we're going to do that, put more energy into our networks and expand our available resources.
Think about losing 449 people to an overdose. For one, that is a preventable chronic disease in which if we can improve our access to treatment, if we can make sure we distribute naloxone into communities that really need it, these are all preventable deaths. So 449 people lost their lives, unfortunately, to a fatal overdose, which could have been prevented. So when I say that one life lost is too many, 449 is too many people just in St. Louis County to lose to something that is preventable.
The most significant challenges around the opioid epidemic are resources, education, getting people to ask for help. You know, it certainly is embarrassing to struggle with substance abuse, and people aren't always ready to ask for help. But this affects all demographic groups in St. Louis County. All families are affected all across the community.
So until we appropriately address stigma all throughout our systems, we're still going to see significant inequities. We're still going to see delays in trying to reduce overdoses. I think the other thing, just as a system approach in our region, that we put a lot of attention on behavioral health, but a lot of times we don't think about integrating substance use with behavioral health. So we're doing a really great job at strengthening the behavioral network that we're creating, but a lot of times it leaves out the substance use part. So for the health department, we're doing a few things to make sure that the community have access to naloxone. For one, we're making sure that the community have access to education. So we offer opioid education, naloxone distribution trainings called OEND trainings. Simply that's a matter of a community organization or individual contacting the health department, and we're happy to get that set up. We also offer mail order naloxone. So if you're someone who don't want to come to the health department, we can also mail out naloxone as well. We are integrating this into all throughout our health department. So eventually, if you see a St. Louis County Department of Public Health truck, my workers will have access to naloxone on their vehicles. So we're currently going through that, so that way if you see us in the community, you can go up to them and ask for naloxone. We'll hand it out to you. And then also our community partnerships. We make sure that we have naloxone available at any community event that we're hosting, even if it's something related to food safety. I make sure we have naloxone available. And then not only that, just walk into the health department. We keep a stock of naloxone just sitting out for an individual to come by and pick up some.
Well, I think it's important to recognize International Overdose Awareness Day in the community, and it helps us recognize that this is still with us. We're going in the right direction in St. Louis County. We started to turn the tide, but we've got a long way to go. We still have way too many people who are struggling with substance abuse, who are losing their lives. Too many families are impacted by this. And we need to take this moment to stop and recognize we're starting to win. We've got a long way to go. We've got a lot of resources to bring to bear. We're going to expand those resources, so let's get the message out. If you're struggling with substance abuse, reach out. Let us try and help you. Reach out to a family member. Let them try to help you.